is one of the most important things we have to do for our patients. We have to consider that we have an extreme variability in the bleeding phenotype because of PK variability, because of variability in the type of activities of our patients. Thus, we have to tailor treatment according to the needs of our patients. In other words, one size does not fit all patients with hemophilia. We have to identify some tools useful for tailoring the treatment of our patients. We have been using pharmacokinetics to improve the tailoring, and this is a really good option to provide to our patient a good protection, an overall protection from bleeding episodes, and specifically from joint bleeding episodes. We have to start considering also the sport activities, the daily activities our patients want to do. And by a personal point of view, I think that it's also important to start modifying the outcomes we have to use to evaluate the performance of the tailored prophylaxis. We have to check ABR. I'm sure about this is a useful outcome, but we have to add something else. We can add patient-reported outcomes. We can discuss about pain. We can include some ultrasound-derived outcomes, such as subclinical bleeds, such as the presence of synovitis intended as a marker. First of all, we have to recognize that we have some important pivotal studies focused on the Damocles valve, and we have great results. We had the opportunity to discuss about real-world data, and real-world practice is a main aspect in hemophilia care. We have to discuss real-world practice, we have to discuss data coming from real-world practice. And analyzing this data, we have the proof of the great protection we have been able to provide to our patients. We have the proof of the reduction in the number of injections. We have the proof in the reduction of the factor VIII concentrate consumption, and mainly we have the proof of the protection we have been able to provide to our patients. And most importantly, we have the opportunity to discuss about some corollary outcomes, such as the ultrasound-derived outcomes. I think we have to discuss about ADR, about target joint resolutions, which are main outcomes, but we also have proof we have been able to modify synovitis, we have been able to reduce synovitis for some patients. This is a great achievement by a clinical point of view.